Good evening, everyone. Bob Diamond coming to you from the Cambria Heights High School. It is now 6:30 p.m. And we have just concluded our Zoom question and answer session on parent trainings and resource sharing that occurred today at Cambria Heights School Buildings. And what I was hoping to do was just touch base on some of the things that were discussed today and some of the feedback from participants. So the following slides that I'll be talking through were part of the presentation today. And what we were really trying to focus in on is collectively as parents and family members and community members to really focus in on helping the youngest and the brightest, our students through some pretty rough times that we've had the last couple years, and lots of I know everybody always says uncertainty and a return to normalcy and those type of things. But there's been, some real specific things that we've seen and some stressors that have been difficult for everybody. And we wanted to talk about some of the things that we've learned from each other, some of the things we may have known before, some of the things, there's definitely not a manual for the types of things that we're all going through now. So some of the slides will include that and some of the recommendations from the experts in the field right now. But the one thing that I definitely want to emphasize in any discussion or resource sharing, that we're by no means giving out any type of medical or behavioral health advice. This is definitely, just to share information, share resources. And if there's ever any question or you're concerned about somebody, please contact your healthcare professional, behavioral health hotline or resource, which those are included in the resources and the links to within this presentation. But if there's any question at all, please make sure you seek out a professional. Now, some of the things that we discussed today and we have heard from people that we deal with on a daily basis and live with, the unbelievable stressors that have come up, that have seemed to concentrate, and they come and they go, and every time you watch the news. So some of the things have been, the disruptions in school and some of the changes that we've had to make in the workplace. Worried about family members, having people we work with, or having students who are testing positive for the virus and being quarantined or being isolated with symptoms. These have been very disruptive to the things that we're used to doing. And it's been a long go of these disruptions. And this year has been excellent to date. Even with disruptions, being in person is something that we're so thankful to have the opportunity for. So when we're talking about anxiety, just basically, there's so much information out there. Everybody has their own take or their own twist to it. And the types of things that you can do to help yourself through it or help somebody you love through it. But as far as what we're talking about today, there's a normal level of anxiety that we all have, that it's however you want to look at it. Is it a survival mechanism? Is it but it's worried about what could happen in the future, or if there's going to be a negative result in the future based on something that's rational or in front of you, or may not be. So some of the things that especially we see in younger students and younger family members, without the they're still working on communication skills and getting in touch with how to express certain things, or communicate what they're thinking about, or what's really nagging at them. So a lot of these students are coming in, and they have a lot of difficulty, their difficulty concentrating and sticking with a task, or they might be restless, or talking fast, or irritable, frustrated, angry, even complaining of wow, the headaches, the stomach aches, all those things. So a lot of those things are very natural reactions. And what we're most concerned about now is what's happening, it's starting to make a real impact or effect on a student's life or a child's life. The things that they're usually able to do are becoming much more difficult, or near impossible. And we've seen an acceleration in those kind of barriers for kids. So some things that some normal anxieties, and some we all remember separating and going away from people that were family members or friends, and those type of things. But we're talking about things that are much more intense, that are changing the way we go about our day, and those are the things that we're really trying to work with our students on, especially when they have a lot of other things on their mind, not just what they need to do in school. So, and we know that everybody out there, caregivers, parents, community members, we see the same. We're seeing the same children, the same young children, the same teenagers, and we all have a role in helping as time goes. So when students are having high levels of anxiety, that they're it's almost a daily, or could be definitely a daily experience, and there's more of not being able to attend to things, not being able to concentrate, maybe withdrawing from things that they usually did, or they're not talking as much, or they're talking too much, and they're avoiding some of the things that they really enjoyed. They're picking easier things to do, not as much energy, too much energy. So it's a change in what is typically or normally there. And I know what's normal, what's typical, and a lot of the times family and friends are in the place to really see a change like that. There's just something off, and it's off to a degree that we're worried. So those are some of the things that we're really looking at. And with younger students, there are some similar high anxiety type of symptoms. Whenever they're clinging to a parent, having so much difficulty separating, and not sleeping and being scared and having behavioral types of highs and lows that just aren't they just were not present before. And whenever students are coming into elementary ages, the concentration, even aggressiveness or aggressive toward or rough on themselves or perfectionistic. Some of those things, just how it looks is similar, yet there's some unique parts. And the important thing to remember is when children are younger and they don't have that skill of knowing how they're reacting to something or be able to communicate that. That's a big issue that we always try to work on to help students, give them opportunities to learn how to do those type of things and work on those strategies. And when our young students are getting a little bit older, getting into the teen years and have a great idea about how everything works, and we're trying to teach them hit the brakes a little bit here, so this is normal development, whatever that may be. And but we see some drastic changes too with some teenage students that are they're dealing with high levels of anxiety, and it's similar, even though they can express things. They're still having a lot of difficulty with explaining exactly what's going on, and sometimes they're just acting through things, and they're having difficulty paying attention. The behaviors, or they're testing boundaries, and the physical complaints. So there's definitely some similarities in how and how these students react to high levels of anxiety. And the only reason why we're talking about some of these specifics and similarities is that you want to know what to look for, and you want to be able to acknowledge whenever you start seeing some of these things that are concerning to us. And one of the biggest strategies, one of the best strategies that we've had, and I've been in the business for a good while, and one of the best things we can ever do is communicate, or try to touch base, however it is. And I'm talking about students who may be nonverbal in that they're not using words, but their behaviors are communicating a lot to you. The whole way up to the most articulate young person that we see, the need to talk and the need to listen as somebody trying to support somebody is a skill that we work on, that we all work on. And that's one of our best strategies that we have is providing that time or that opportunity for students to learn how to do that. So whenever students are they are coming home, and it's always difficult because so many of us are working, we're helping family members, we have our own issues that we're attending to, and then we come home and we have a young person who's really struggling, and we have to put in this incredible amount of energy into listening, and talking, and answering questions, and that's definitely that's part of the vocation that we have as parents and family and community. We all chip in to do those type of things. As coaches, as as instructors, as community agency club leaders. We all have some of those things to do. So we did discuss some of the recommendations, some of the tried and true things that we try to keep consistent. And there's some excellent resources out there that are people have really paid attention and had the opportunity to add some valuable resources and update some of these areas to make them very user-friendly to families and to give us what we need to become experts with our own kids, which we already are, but it makes us even better. So there are a couple of the resources that we refer to. The healthcare toolbox is one that it's great how they communicate, and it's not something that is one of those things where you have to have the thesaurus out and really thinking about wow, I'm not in this field. But it's more like just talking and talking with a friend or talking with somebody that just has a lot of really good experience communicating with kids and helping them through these type of situations and times. So there are some of these resources. Some of the ones that from the CDC. They're an agency that that some of us watch very, very closely, and they've been they're helping and they're making us frustrated at the same time. But the resources that they have here, especially for supporting children, supporting students, supporting families, are excellent. And they're very honest. They're very positive. And you have to definitely look at it as a family or as a parent and say, well, this may be within, something that I would consider, or maybe this is something that, that's a little bit too far. But just to have something to look at, some days is very, very helpful. And some of the local resources that we have within the county, and I know that it's strange because we're closer to Blair County on this side, but even though we're in Cambria County, but I mentioned before in the opening, if there is any thought or concern or worry that a young person in our community, in our school, or in our home is really struggling with something. It's something that it's such a drastic change or intense, or they mention anything, or their actions about harming themselves and others, or just this hopelessness, this withdrawing from everything. Please do not wait. It's definitely not, it's not the best time to look up, kind of do research on something, or that's a time where it's absolutely critical that you contact your pediatrician, your family doctor, your healthcare provider, your a behavioral health or a mental health agency, and make that contact. Or there are crisis hotlines where they can help you determine if there is a medical emergency occurring with someone you love. And these are agencies that I have had contact with quite a few times over the years, and typically they're very cautious, and they're systematic, and they're careful. They follow through, but it's something if something doesn't feel right, make the call. Let the people out there who are there help you. Please do that. Please do not wait. So there are some of those resources there. And we did have the Zoom session, and I really like the format of following up on some of the information that we present. It's been a difficult year, and there's been such intense topics out there that the things that we're really together upon, making sure our kids are okay, making sure they're safe, making sure they're learning as much as they can, academically, socially, problem solving, conflict resolution, those type of things. That's where I really think that these sessions are very positive, and we can all get together and it's just taking a step back, and we're neighbors, we're on the same athletic teams, we're in the same clubs, we're going to the same places in the same community. So I hope that these type of sessions and this opening up of and discussion of resources will be very helpful as time goes on. So Dr. Little, the school psychologist, was very helpful to me in gathering some of these updated resources. She is a absolute wealth of knowledge, and just has some very good experience working directly with students and families, children, and how to navigate through a lot of the things that may be short term or long term. And she has a lot of excellent resources on her website. And she has directed us to a lot of these updated resources today. So I wanted to thank her for her participation, and I'm sure she'll be adding something to this in the future. But as we break for the evening, it's been dark out for a couple hours. I hope that as many of you as possible were able to check out our resources, and when we provide this PowerPoint, the links will be active, and if not, I'll be providing some sort of document that'll have some of the links to some of the things we just touched on with this overview. So wish everybody a good night, and enjoy Veterans Day tomorrow, and thanking all of those who work so hard to keep us safe, and to keep this best country. And we will see you Friday. Okay, good night, everybody.